Meanwhile, Medical Monday, long COVID, could it be reactivating old health issues? This is a big thing for lots of people, isn't it? Long COVID, when you have symptoms lingering for weeks after the original corona infection. You may have fatigue, brain fog, trouble breathing, continual disruption to taste, smell, etc. Some people, though, have been reporting that along with their long COVID, they've been having symptoms of previous viral infections, so things like shingles or glandular fever. And both of these conditions are caused by viruses that can stay dormant in the body after you think you've got over them. Shingles is a reactivation of chickenpox. Glandular fever is caused by the Epstein-Barr virus, or EBV. So the question that is really puzzling the medics now is whether long COVID is so bad because it reactivates all the junk in your system already. Scientists are looking into the possibility that coronavirus might reawaken these other viruses. Let's talk about this with Dr. Sarah Jarvis. We would love your comments and questions. vine@bbc.co.uk. Sarah, hello, by the way.
Hello.
We heard the other day about long COVID possibly creating people new allergies, so they would suddenly find they're allergic to house dust or nuts when they hadn't been before. This is new territory, though, isn't it?
This is slightly new territory. Now, interestingly, the National Institute of Health Research suggested that, in fact, long COVID may not be one syndrome. It could be 4 syndromes, and some people might have more than one. So there's the post-intensive care syndrome, where you get, really ill, you end up in intensive care, and when you come out, particularly been ventilated, you haven't been moving for weeks, then you have to learn to sit, speak, walk, swallow, talk, do everything again. Then there's long-term organ damage, and of course we know that COVID it doesn't just damage your lungs, it can damage your clotting system, your kidneys, your skin, your digestive system, your heart. Then there's post-viral syndrome, because there are quite a lot of shared symptoms between long COVID and chronic fatigue syndrome, which, as you know, can be really debilitating, and where we suspect that a lot, possibly all, cases of chronic fatigue syndrome are related to a viral infection. And then there could be something completely new, which is this novel long COVID syndrome. So where this fits in, we do know that if your immune system is distracted, if it's busy or if it's compromised, then it can give things like shingles a chance to reactivate. So it may be related to that. OK, I'm just trying to work out whether actually the long COVID therefore might well be just another version of post-viral fatigue / chronic fatigue syndrome, and therefore it's something we know quite well. Well, the sadness, firstly, is that we don't know chronic fatigue that well. I wish we did. There's been huge debate as to what caused it, and it's been very difficult to pin down a single virus starting it. What we do know, of course, is that like long COVID, chronic fatigue syndrome can be incredibly debilitating, and that at least in a number of cases, a significant proportion, there is an obvious viral trigger. The difference, I suppose, is that because we don't have tests for other viruses, then many people, we suspect, with chronic fatigue syndrome have had a viral infection, but the underlying virus was never found.
Let's hear from somebody who thinks it reactivated a different illness in their system. Jerry Betteridge in Helston. What happened to you, Jerry?
I had my 2 jabs, Jeremy, and then 2 weeks later I went down with shingles for the 3rd time in my life, and that lasted for about 3 weeks, and the GP, when I spoke to them, really just said he could only think that it may well have been just having been run down a bit after having had the 2 COVID jabs, and it reactivated the shingles. And then when I recovered from shingles, about 4 weeks after that, I got yet another bad virus, which knocked me out for about 4 weeks, and I lost a stone. It was just really, really bad.
Gosh, as my mum always said, you've been in the wars. That's no fun at all. Sarah?
Well, Jerry, it's possible that because your immune system was busy developing immunity to what it recognised as COVID after you had the vaccine, that your shingles may have been reactivated. There was a very small study in Israel showing that vaccinated people could get shingles, seemed to be more likely to get shingles after their first dose of COVID vaccine. But interestingly, there were 6 people in the study who developed shingles, and they all had pre-existing conditions that lowered their natural immune response. Yeah, so I think that it's possible, and we're doing studies on it, but as yet, there's nothing in there. There's nothing in the submissions to the MHRA or anywhere else internationally that suggests that the vaccine could reactivate it.
And Jerry, did you say you'd had shingles before?
Yeah, I had it twice, once 20 years ago and once about 10 years ago.
Would that count as a predisposition, Sarah, or an underlying condition?
It's some people get shingles more than once, but it's not common. You have been really, really unlucky. We know that people who, for instance, are immune suppressed, so they're taking, for instance, they've got blood cancer or they're on chemotherapy, they can get reactivation of shingles, and it can be really, really nasty. So you are very unlucky, Jerry. The second one you talk about, getting the virus, which lasted for 4 weeks, I've had a lot of patients complaining of that recently, whether they've been vaccinated recently or not. And my feeling is that 6, 8 weeks, 2 months after getting the vaccine, it's unlikely to be related to the vaccine.
Thank you, Jerry. Get well soon. Kyra in Plymouth says the first time my 13-year-old daughter had COVID was a shingles rash, and then she had a slight cough. We went for testing. It confirmed COVID, but I did wonder if fighting COVID made her immune system low, and that's why she got the shingles.
Well, it's a really interesting one. Of course, I didn't see the rash, and the rash of shingles is very, very specific. So if she was told that she'd be very unlucky to have shingles at that stage in life, it's very uncommon in young people. What we do know is that anybody who has ever had chickenpox, that can reactivate. So the chickenpox virus lives on in your body, and it lives on in your spine, in what's called the dorsal root ganglion. And that can get reactivated at any time, but it causes a rash which stops dead in the midline, and often, usually in your chest or your tummy, sometimes on your face, stops absolutely spot on halfway across your body, and usually just affects a thin strip of skin, which is supplied by that dorsal ganglion. So she would be very unlucky to get shingles at that age. And yes, it's possible that her immune system was suppressed, and that's why she ended up getting it.
We've heard that in the past that if you're really unlucky with COVID, it goes into the cell's battery, if you like, which the mitochondrial bit of the cell. Now, all I know as a layman is that once you hear the word mitochondrial, you're in trouble. And that is similar to what we're told happens with chronic fatigue, aren't we?
Well, we think so. And again, the thing about chronic fatigue, in some respects, it's very sad that even now there are significant differences between chronic fatigue syndrome and long COVID. But one of the things they have in common is that you are exhausted. I mean, really bone-wearying exhaustion, nothing like most people have ever experienced, unless they've had, triplets and no help sort of thing. But resting doesn't make it easier, doesn't make it better, and that's one of the key factors. And we think that it's profoundly affecting every cell in your body, and that you just can't, your body doesn't rest, your body doesn't recover as we normally do when we're sleeping. OK, stay with us, Sarah. Mark in Bradford says, I've got ME. I see a link between long COVID and chronic fatigue syndrome, which needs serious attention. Both long COVID and chronic fatigue syndrome can be helped with better research funding and listening to sufferers more seriously. Number of people saying it, they do seem uncannily similar. Gosh, long COVID is going to be, I suppose, by definition, Sarah, with us for quite a long time. Yeah, and that's part of the problem we have, that we just don't know how long the symptoms are going to last for. Now, we do know that very sadly, a significant proportion of people who have long COVID have symptoms which last for at least 12 months. And that's really pretty sobering stuff. So even the definition of what constitutes long COVID, interestingly, so NICE came up with a slightly different thing where it said that, ongoing symptomatic COVID is from 4 to 12 weeks. Post-COVID is for more than 12 weeks, and long COVID combines, uses a combination of the two. But what we see with ME/CFS, and we do tend to call it ME/CFS these days rather than just chronic fatigue syndrome, is that many people will have symptoms which last for for years. And I do have a real concern that we are going to see a similar thing here.
Right. Just on the vaccine, if you're vaccinated, you are less likely to suffer badly from COVID. We know that. Are you less likely to suffer from long COVID if you're vaccinated and you get it?
Well, part of the problem is, of course, that the vaccine has only been introduced in the last 9 months, and therefore the number of people who've caught COVID since they've been vaccinated has been relatively small, and the number of people who've had long COVID as a result of that is going to be relatively smaller again. So it's proving difficult at the moment to say so for certainty. But given that it seems to reduce your chance of catching COVID in the first place, not to nearly the same extent, unfortunately, as it reduces your chance of getting severely unwell, I think we can reasonably be optimistic that it'll reduce your chance of long COVID.
OK, let's speak to Suzanne in Coleraine. Hi, Suzanne.
Hello.
Now, you had COVID in August this year, did you?
Yes, the beginning of August I contracted COVID.
OK, so you'd evaded it for a good year and a bit, but then it got you.
Yeah.
How are you doing?
I'm improved slightly, but I still I know I'm not anywhere near back to my normal self.
Take us through it.
I had caught the virus from my partner. He was sick first, and then quite quickly I knew that I had caught it with losing my taste and smell, and then just weakness. I didn't have it so much in my chest. It was more that I just was so weak I wasn't able to get out of bed and just do the simplest of things. Then whenever I had came round slightly, I'd been with my own doctor and had some blood tests, and they had called me back just to say that my thyroid levels were dangerously low, and it's just been different things since then.
Shingles
Then in this last few weeks, and sinus problems, antibiotics.
Have you had a thyroid problem before?
I actually did. Just after I'd had my son, I was on thyroid medication for 3 years. I never felt much benefit from it, and I'd stopped taking it, but somehow my thyroid at that time had corrected itself, so my doctor was keeping an eye, and I had my bloods done every year to check that my levels were okay. But they said that just with having COVID, that it's really attacked my immune system, and I can feel it myself.
Yeah, it's Sarah. It's a great example from Susanna, and unhappy to listen to that. It's almost playing the greatest hits of all Suzanne's previous illnesses.
Yeah, it's interesting, Suzanne, because normally if you have underactive thyroid, then you end up needing medication for life. And although not everybody responds to the medication, and some people, even though their thyroid levels come back to normal, still experience really quite debilitating ongoing symptoms, for the vast majority of my patients, once you're on it and your levels have stabilised, you're fine. You need a blood test once a year. Now, it's slightly different if you develop it during pregnancy. And occasionally you do see people who have their symptoms resolve following underactive thyroid that came on during pregnancy. But that's not common. And I certainly would have recommended that you continue to be tested for it. People who have underactive thyroid, interestingly, are probably more likely to get loss of sense of smell following a COVID infection, which is quite interesting. Now, we know that thyroid disease, in a lot of cases, either an overactive or an underactive thyroid, is what's called an autoimmune disease, where your body is turned on itself and has started making antibodies. Now, again, you see, this is related to your immune system. So in the same way that your immune system might have been suppressed and therefore you end up having shingles, it's possible that there might be a link, but it's not one that's come out. There's a theory behind it, if you like. Interestingly, the good news is that the results so far suggest that people who already have an underactive thyroid or an overactive thyroid don't seem to be more at risk of getting COVID. But does COVID increase your risk of getting an underactive thyroid? Well, that's one we don't know yet.
I hope you get well, Suzanne.
Thank
Good luck.
you.
All right, you take care.
Thanks, bye.
Bye-bye. A lot of people saying they had COVID, and now the long COVID, the main symptom is tiredness. That seems to be the main thing. And actually, Sarah, I read a tweet by Piers Morgan the other day saying, he famously had the vaccine. He got COVID at the Euros final, and he was just tweeting about a few days ago saying he can't. Does anyone know when the fatigue goes?
Yeah.
So there will be a lot of people in that situation who just think, oh my goodness, am I now in the long COVID thing where there isn't really an end to it?
Well, quite a lot of people, it does get better. About 3 in 5 people who have long COVID complain of really crippling tiredness. About 4 in 10 complain of shortness of breath. 1 in 3 muscle aches, problems with concentrating. And then smaller but still significant numbers are getting chest pain, headache, dizziness, pins and needles, brain fog, tummy pain, diarrhea, loss of appetite, and the list really, really does go on. What's perhaps quite reassuring is that the Office of National Statistics produces regular estimates of the number of people who got long COVID. And in August 2021, which is the most recent one we've got, they said that about nearly just shy of 1 million people, that's about 1 in 70 people, had long COVID, which was over 4 weeks, and about 800,000 of those had symptoms for at least 3 months. Now, the good news, between May and August, the number of people who said they'd got long COVID did remain pretty much unchanged. About 40% of people said they'd had the symptoms for over a year. So I think what's happening is that you're getting people dropping off one end and being added at the other end. So about 4 in 10 chance of having symptoms for over a year, but a significant proportion of people do get better within a shorter time.
Thank you so much for your time, Sarah.